Hi, everyone. Good afternoon. My name is Bentley Ponder, and I'm a Deputy Commissioner here at the Georgia Department of Early Care and Learning. It is 1:12 on Wednesday, September 25th, and we have just concluded the third of four planned stakeholder meetings. Unfortunately, there is a hurricane coming to the area, and it looks like we will not be able to do our meeting on Friday. So we are recording the presentation that we have done at each of these meetings, and we will have a way for you to share any feedback or ask any questions. We certainly apologize for not being able to be there, but I think everyone understands, and I think it's also good that we have this recording. So at each of the meeting, I've talked about part of the purpose for doing these and why we have liked doing them in person is we know that there are a lot of changes that are happening. We know there's a lot of just different things hitting all at once, and we wanted to come out, see if we could provide more clarification, more explanations for what's going on, but also hear from you and get your feedback. In terms of the agenda, so I kick things off with a general overview and context. Then I turn it over to my friend and colleague, Woody, who will talk specifically about the CAPS rate increases. I know a lot of this we did in previous webinars, but there's more information now, and I think the context really helps with this section. Woody will transition to Denise Jensen, our quality rated director, and she will talk about our new commitment to quality payments, formerly known as tiered reimbursement, and then also our quality rated workforce bonuses. Kind of a little sidebar here. Denise and I are really excited about this and the changes that they'll bring, and just look forward to sharing more around those. Woody will come back then and talk about some different provider rate scenarios and talk through those, which are important after hearing about the commitment to quality payments. And then following him will Ann Panzica will talk about provide more additional rate information, and then talk about our different CAPS provider supports. And I will close with two slides talking about our Thriving Business Academy, and again provide a reminder on how you can submit questions. And speaking of questions, so here we have a QR code. If you scan the QR code, you can send questions directly to us. Those questions can be anonymous, or you could put contact information if you would like a follow-up. You can see from the slide that we did have other methods during the live presentation, but the QR code was actually the most popular during those, and it has worked really well. All right, that being said, let's kick off on talking about context. So this first slide here is an overview of the four big things that we'll be talking about today. I think that it's helpful to Sorry, I apologize. There was a reminder that popped up on the computer. So this is an overview slide. It talks about the four big things that we'll be talking about today, and really summarizes at least these changes. I know there are other changes, but these are the ones that the stakeholder meetings have been focused around. So number one, for most types of care, we are increasing the CAPS rate to the 60th percentile. This is a really big deal, and it's pretty much unprecedented in at least the CAPS history that I'm familiar with. Uh, it well, Woody will go into more detail over that. Then we'll talk about the tiered reimbursement payments. They'll transition to the commitment to quality payments. These will be for our 2 and 3 star providers. 2 and 3 star providers receive a quarterly payment of 5% and 10%. And then those will be made quarterly as a lump sum. We will also be, and really excited about this, introducing a $500 quality rated workforce bonus. There's a lot that we are still determining with this. There's a lot of policy that needs to be written around this. So when Denise talks about this, you'll hear some of those questions. And there are things that we would love to have your feedback on around these workforce bonuses. So please pay attention at that section. And then last but not least, we are expanding supports with all these changes through our CAPS provider relations unit, and then also our DeKalb Thriving Business Academy. So I think it's important as we talk about these changes to understand the context from which these changes are occurring. So the one that's the bulk of the changes we're discussing today is related to our new CCDF plan. As many of you know, m- much of what we do at DeCal, actually much of what we do in early education as a state is funded through the Federal Child Care Development Fund. Not solely, there are a good amount of state funds that come in uh, uh, with this, and of course, then there's some other smaller funding sources, but a lot of what we do is under CCDF. And this is a block grant that comes to states where we're given a certain amount of money that we are able to allocate to our CAP scholarships and to some of our other programs. Every 3 years, we are required to create a new state plan, and that details how we as a state will meet the Child Care Development Fund guidelines. This is a big deal. We started working on our plan earlier this year. There was a public comment period with our plan, and I mean the main thing to know is that this new plan goes into effect October 1st, 2024. That is not a date that we determined. That is just when the federal fiscal year starts. So that's why that October 1st date is there. And normally we would be talking just about this, and we would be talking about how, about these changes to the rates and everything with that. Uh, just around, wow, they've got this new CCF plan. But unfortunately, or just, coincidentally, it happens to begin right when much of our pandemic relief funding is concluding. So we have, as many of you know, American Rescue Plans. That's one of three funding sources, or three different federal legislative plans that happened as a result of the COVID-19 pandemic. It was the biggest and it was the last, and it made up a big percentage of the $2.1 billion that DeCal received through these funding relief packages. Those funds, as many of you know, must be expended by September 30th of this year. Again, those are federal guidelines, not anything, that we would determine in state policy. We did a lot with these funds, as you would know, and it was a really it was a really it gave us some incredible opportunities. So we were able to use those funds to pay for access, which we're able to pay many of you your stated rate. We were able to increase the tiered reimbursement percentages. I know stable ended last year, but we were able to do those stable payments. And then there were other critical initiatives that we were able to do with those funds. It was a really great opportunity. But, as we said from the get-go, and we knew as these funds were distributed, they were one-time funds and they would expire on September 30th, 2024. I think most importantly in understanding these funds is that they were used to increase the number of children and families that we were able to serve in CAPS. So, as we'll talk about throughout the presentation, our CAPS program is designed to serve approximately 50,000 children. We were able with these funds to increase that to around 72,000 children, but now that the fundings have ended, we must attrition back to that 50,000. We have been working on this for a while. We have been doing things internally. We are doing everything we can to minimize the impact to families, and that we certainly don't want to create additional stresses for families and providers. But the bottom line is that is what our funding allows, and so we are in the process of attritioning back. And it's important to know that to understand some of the policies that are being implemented. And then related but not specific to some of the things we're talking about today, but it's important for everyone to know that in March of 2024 this year, the Federal Office of Child Care, and that's the office that administers the CCDF funding, issued new rules that we are required to implement. And we're not going to go into those rules. I think if you go to some of our previous webinars, there's more information there, and you can certainly find those yourself. But just know that we have applied for a waiver, as most states have, but we are, beginning to prepare and adjust policies for the implementation of those rules. So I just say all that to say that, we are in a time of change. I would love to say that change is ending September 30th, but, we know that change will be ongoing. Apologize, I can't get to the slides. All right, so this next slide is an overview of our new CCDF plan. And I think it's important to know that one of the things we learned throughout the pandemic was the importance of having policies that we are explicit in, supporting families, supporting providers, supporting the childcare workforce. I mean, really looking at the system as a whole. And from those priorities that we used in our federal pandemic relief packages, we've also used in creating our new CCDF plan. And as Woody will talk about in a few minutes, going to that 60th percentile really is a benefit for families. And that reason is that will lower the differential that families pay. It's become obvious to us as we've been doing these meetings that we haven't talked about the differential in a long time. We haven't had to because those pandemic relief funds allowed us to do access, which allowed us to pay the stated rate. But now that we're going into our new CCDF plan, we don't have that federal pandemic relief funding anymore. We will be talking about the differential, and going to that 60th percentile does impact families, and hopefully will lower the cost of care for our families receiving CAP scholarships. We also, as you know, have many things for providers. And so as we talk about the new commitment to quality payments, and then many of our other initiatives specifically related to providers, and going to that 60th percentile does raise the amount that we are distributing to you. And then, of course, our $500 workforce bonus payments that will be starting in 2025 show our commitment and, the value, and we know the importance of the workforce. Uh, our new CCDF plan continues the program design of serving 50,000 children. So, that number came through a lot of stakeholder research, that stakeholder engagement that we did several years ago, and that is the way that our program is designed. So we know from providers that's a good number statewide to look at, and in our CCDF plan, we have continued that focus. We've also continued to emphasize our federal priority of serving children in higher quality settings. So, that is a federal priority. And so our CAP scholarships, we should, as much as we can, direct to higher quality settings. And that is reflected in the new commitment to quality payments. I think it is important that even though we talk about some of the federal funding ending with those pandemic relief packages, we are developing our plan with new increases that's related to state and federal funding. So we have had additional state dollars that have come in to in around caps, and of course there's actually been federal increases not related to the pandemic relief funding measures, but specifically to CCDF. And then, of course, we've talked about the end of pandemic relief funding and the fact that our new plan goes into effect on October 1st. So, all that being said, before I turn it over to Woody, just so everyone knows, we know that this is not, there's a lot of changes taking place. We are excited about elements of our new CCF plan, but we know that it's against the backdrop of pandemic relief funding ending and the need to attrition back to 50,000 children. We are doing everything we can to minimize the impact of that funding ending, the need to attrition back to 50,000 scholarships. But we know that there is that impact, and we just wanted to make sure that we were clear in expressing that, and thought that was a good way to kick off some of the formal parts of the presentation. So with that, I will turn it over to Woody Dover.
Thank you, Bentley. My name is Woody Dover. I'm the Enterprise Project Management Director with DECAL. And in my role, I work mostly on the finance side, but I also work with our leadership on special projects and the co-state administrator for CCDF. So in that role, I work with my other co-administrator to ensure that DECAL and the state of Georgia is meeting our obligations related to the Child Care Development Fund block grant, which is CCDF and funds the majority of funds the CAPS program, but also many of the activities at DECAL. And so what I want to talk about today is a little bit of just unpacking CAPS rates, what makes up a CAPS payment, as well as just kind of how we go about the rate setting process and what the rates are moving forward. So in general, like CAPS payments, there's several components to that. And as we kind of shift away from this access-based world of payments to this back to kind of more standard policy, it's good for us to kind of recap and refamiliarize ourselves with the different parts of a caps payment. And so what we have is that we have a caps rate. And then the caps rate is actually has two parts to that. One of those parts is the family fee. And then the other part is essentially the balance of the caps rate, which decal will pay. So an example of that is one of the new rates we have going into effect in zone one for childcare centers for a toddler is $248. And so the caps rate for that care is it's $248. But if, say, I had a family on that scholarship and they had a family fee of $20, then of the $248, the family would pay $20 each week, and CAPS would make a reimbursement of $228 equal, and then the two of those together combined to be $248 for the total CAPS payment. Now, we have what's called, or what we call, a differential. So a differential comes into play when a provider's rate is greater than our CAPS rate. So in this hypothetical situation they're talking about with the $248, if the provider providing care has a weekly rate of $268, so $20 higher than our caps rate, $20 would be the differential in this situation. So we have a family fee of $20 and a differential of $20. And the two of those combined make up what we call, and what is on the scholarship, the parent weekly responsibility. So there's two items on the scholarship. Just to recap, is that we have a family fee, and that family fee is determined once a year at a family's redetermination. And then we have a parent weekly responsibility that is the family fee plus any differential that potentially exists with that one particular provider of that scholarship. Now, if there's a provider where their rate was 248, the same exact rate as a caps rate, well, then the parent responsibility would be only $20 because that's just the family fee. All right, so the rate setting process. So Bentley's mentioned the CCDF state plan. That's been something that we talked about a great deal lately at DECAL, and have many webinars about the CCDF state plan. And it's come up a lot in the webinars leading up to the caps rate changes. And so with the CCDF state plan, we're required to um, do do an evaluation of the price of childcare throughout the state every 3 years. And that's what we call a market rate study. So we collect provider published rates. This time around, we did so in the summer of 2023. We collected, we had providers who participated in Stable report to us their public rate. We had over 80% of providers respond with rates, and which is a very large response rate. And we were able to do an evaluation. And the way we do that evaluation is we take the rates submitted to us, and then for each county in Georgia is assigned to a cap zone, or a market zone. So a market rate, so 1, 2, and 3. And so we take all the rates received for market zone 1, combine them together. Zone 2, we combine all the rates together. In zone 3, we combine those together. And for each of those zones, then we create essentially a distribution of those rates to determine what is typically the 25th, the 50th, and the 75th percentile. And then we do some stuff in between. And the whole point of that is to understand, make a comparison across each zone, so then we can use that to set rates. So example, we would look at what's called the 50th percentile. Would mean that a parent could take the caps rate. If the caps rate was set at 50 percentile, which is the federal minimum, the parent could take that caps rate at the 50 percentile and theoretically go to one out of every two, or 50% of providers in their area, and not have to pay anything more than their family fee. And so that's the kind of rationale behind that. And so, like as I mentioned, the Office of Child Care requires us to be at the 50th percentile. In the past, that requirement has been as low as the 25th percentile. And then even when DECAL inherited, or was, the program was given to DECAL back in 2013, that rate was a much lower percentile of the market. It really wasn't until the 2016 plan where the Federal Office of Child Care started requiring states to begin increasing their rates. So where are we setting rates moving forward? So as Bentley mentioned, we're going from the 25th percentile, which was what it was in 2019, to the 60th percentile moving forward. And so as I mentioned, that's actually above the required minimum as we know it today, which is the 50th percentile. And a lot of the reason for that is twofold. We want to prioritize in this time of transition that we want to get that rate up as high as possible to try to lower the financial burden to families as much as possible moving forward. In addition to that, we received funding from the legislature to go above the 50th percentile. So that legislative mandate, encourages us to go all the way to the 60th percentile is what we felt we could afford while still maintaining the priorities around um, quality improvement and the quality rated program with our quality payments, as well as adding a new initiative with the workforce payments. We felt that those were really critical projects moving forward. So overall, the CAPS rates, full-time care is going to the 60th percentile. This, as far as we know, complies with all known federal guidelines at this time. It also prioritizes our desire to reduce impact to families financially as we go through this transition. As it relates to at before and after school rates, those rates are going up by 5%, which is not as large of an increase as 60th percentile. So the rationale there is that we are prioritizing full-time rates because that is the priority of the Office of Child Care. It's also about limited funding and having to make decisions on which priorities require the most amount of funding. But in addition to that, as it relates to before and after school care, our cost study that we did showed that even at the new rates for before and after school, they're all in all areas of the state above the cost of care. So that helps us to understand how we prioritize and what impact that has. Now, as we know, many of the families and children served in CAPS are on what we call variable schedule scholarships. And so the child is, maybe attending after school during a typical school week, but like say on a break, like winter break or spring break, the child might come for full day care, or in the summer, they might transition to full day care. So when those scholarships transition and allow for full day care, then those full day rates are then at the 60th percentile. And last thing I'm going to share before I hand it over to Denise is just a comparison chart. So once again, we're talking 2019 to 2024. Why are we making those two our comparison timelines, or our points of comparison? Well, 2019, that's the last time we essentially set rates. And once again, they were set at the 25th percentile at that time. Now we're moving to the 60th percentile in 2024. And so this illustration just shows, what that change looks like as it relates to toddler care for CAPS providers. And here we have provider type, we have child care center, family is family learning homes, and then our 1, 2, and our zone 1, zone 2, and zone 3. All right, and I'm going to transition it over to Denise, and I'll be back shortly to talk more about some scenarios.
Thanks, Woody. Hi, everybody. Denise Jensen here. I wish I could say it is wonderful to see you in person, but as Bentley had mentioned, all due to prudence, if you're listening to this recorded webinar after September the 27th, we hope everybody weathered the storm safe and soundly and are still able to get the information that we would have been sharing in person. I hope you're taking the opportunity to use the QR code, as we do value hearing from everybody. If you need additional clarification, have questions, we will make sure that those questions are answered, and we will be posting answers to the questions along after this webinar has been reviewed. So I'm here today to talk just a little bit about something that is really exciting and a real departure from what we typically do in quality rated. As everyone here knows who is a quality rated provider, we have spent the last 12 years building a system primarily focusing on quality improvement, providing resources to providers to help them improve the quality of services to the children and families. We have not typically been in the arena of making payments to providers. That has always been part of the mission of our friends in CAPS and some of our other divisions. So while quality rated has always had the ability, we've been very fortunate in the past to have kind of temporary and tenuous bonuses and ability to have things that are have been funded through philanthropic dollars and temporary federal dollars through the COVID relief funds, we have never had the opportunity to really be involved in those ongoing permanent payments and bonuses to our workforce that we are now going to be able to offer. So it's very exciting for us, but what that means is a lot of work in terms of developing new policies and procedures and structures to be able to support those payments within the quality rated program itself. So as you can see here on this slide, we will be transitioning away from the current method of paying tiered reimbursement, which has been received with your CAPS weekly billing. That's become part of everybody's kind of ongoing revenue source on a weekly basis. We are looking at the commitment to quality payments being a completely new structure that will be separate from your weekly CAPS payments. And these new payments will be distributed as a lump sum to your programs in efforts to really get back to what we had hoped tiered reimbursement will be able to do, which will be able to take the reward or the additional funding to be focused entirely on those quality improvement processes that you've been putting into place to be able to reinvest and maintain those levels of quality as you've been striving so hard to reach those 2 and 3 star levels. So you can see here on the next slide, the commitment to quality payments will be made available to 2 and 3 star level programs. And the 2-star programs will receive a 5% quarterly bonus, and the 3-star programs will be receiving a 10% quarterly bonus. And this was really not an easy decision, and is maybe a little bit controversial to some, but the decision was made that 1-star providers, CAPS providers, would not be eligible to receive this quality payment, and that the difference that they would have would be made up in that 60th percentile rate increase. So what that means is, for the first time ever, we will only be paying an increased bonus to the 2 and 3-star programs. But what that is allowing us to do within quality rated is to really focus on assistance to 1-star CAPS providers as we move into 2025. For the first time ever, we have the capacity to really try and do something new and different with our 1-star providers, as the 1-star is now the new floor for CAPS providers. Previously, in order to participate in CAPS prior to the mandate, providers did have to be licensed, and then that 1, 2, and 3-star was above and beyond licensing. Now, with that movement to the 1-star level being the baseline requirement for CAPS, we're looking at really being able to work intensively with 1-star providers that would like to engage with us next year to really do some things different around hopefully receiving that 2-star rating or higher. So for all of those 1-star CAPS providers, be on the lookout. Probably in the next 2 to 3 weeks, we will be surveying all of the providers that fall into that arena to really see what additional resources, supports, and opportunities would work for you if you would like to attempt to come back through next year and achieve that higher rating that would then make you eligible for these commitment to quality payments. The next thing to know about these new payments is the structure of actually processing and making the payments will be very different than how you currently experience tier reimbursement. As you know, your tier is currently paid on your star level through Maximus with your weekly billing. Moving into 2025, the new payments that will come as lump sums quarterly will be made through our payment partner, Care Solutions. Now, the percentage that you receive, which is based on your star level, will still be based and calculated on your CAP service weeks the previous quarter. So we'll be able to look and see how much you billed CAPS for, how much you was paid each service week during that previous quarter, and then those calculations will be made for the 5 or 10% based on your star level, and then those payments will be made. You can see here the schedule that we're currently looking at for 2025 payments will be in February, May, August, and November. So that means for the quarter 4 this year, that payment will be made in February. So I know many people are going to hear that and wonder what's going to happen then from, October through December, knowing that you're not going to have that tiered reimbursement. We are actually going to be making an additional payment to providers in December that will account for this first or this fourth quarter of 2024, and that will be prorated. So the way that that's going to happen is we will be looking at the first 5 billing weeks in October and the first week in November, the first 5 weeks, and then the calculations will be prorated out to cover the entire 14-week quarter, and then that payment will be made in December. And then, of course, we will have your entire billing for quarter 4 to be able to calculate accurately that payment then that you'll receive in February. So it's going to be a kind of a little bonus payment in December, basically be paying twice for the fourth quarter. The next thing I'd like to share with you is the really exciting news around our quality rated workforce bonuses. Again, in the past, we've had the ability to make some workforce incentive payments with the COVID federal funds that we had. And then we had some kind of minimal workforce incentives with our initial quality rated star level bonus packages when we began quality rated. But this is something that we was never able to guarantee would be ongoing and continuous. And so for the first time ever, we now have this continuation of these annual payments that will be able to be made to all workforce at all 1, 2, and 3-star providers. So this is not just tied to CAPS providers. This is all quality rated providers who will be eligible for this 500 bonus for each one of their eligible employees. And so we know that $500 it's never enough, but it does represent a large investment that the state is being able to make, and the investment will be ongoing. And as you know, in future years, hopefully, if we receive additional funding, the goal would be to be able to have this structure in place where we could continue to increase the amount of money that we can put behind these bonuses. And this is a way to recognize and acknowledge all of the hard work that goes into the enhancements that your staff make in order to make quality happen in your programs. And so we're going to take a look on this next slide at who is eligible for these workforce bonuses. And so, as I had mentioned, the bonuses are going to be payable to all quality rated programs, whether you are Family Childcare Learning Home, Family Childcare Learning Center, or a standalone school age program. No matter your setting, your program, as long as it has a 1 through 3-star rating, will be eligible for this bonus. You can see here, as we're developing policies and procedures for this, we had to make some determinations on who are those eligible staff. And if you had listened to the webinar that we did a couple of weeks ago, we didn't have this information at that time. We was planning on the staff that were eligible would just be your education level staff, but we did hear loud and clear on the survey that followed that last webinar that there was really an understanding and a need that all staff in a program make quality achievable. And so we did make that determination to be able to look at being able to pay these bonuses not only to education but also to support staff. So that would mean the folks who are in your kitchen cooking for the children, providing those nutritious meals, for your bus drivers who are making sure that children are being transported safely from their schools to your facility. So we did want to be able to include all staff, but in order to do that, again, just like everything else, we have a finite pot of money. So having to put some eligibility around working conditions, working hours, time of employment, that allowed us to be able to extend this opportunity beyond just the education staff. So as you can see on this slide here, As of right now, we are looking at developing policy around the average number of hours that staff would need to work at the facility in order to be eligible. And right now we have set that at 20 hours. That is, I can tell you now, that's not necessarily set in stone. We still are going to be working. A lot of more detail needs to go into determining the policies and procedures on this, so that number may change. That is definitely something that still may look a little different once we actually announce all the policies, as will the decision around the number of days that a employee would be required to have worked at your facility. Right now, we're looking, and we kind of learned a lot through our power payments. We have that set at 60 days. Again, that is not necessarily set in stone as of where are we? September the 24th at now 1:47. But that's that's the information that we're looking at right now. Obviously, as we hear feedback from our provider community, some of these things may be subject to change as we finalize all of those policies. Again, what we do know, however, about these workforce bonuses, again, these will be tied to our partnership with Care Solutions. So as we think about a complete rebrand of the payment piece, moving it away from CAPS and into quality rated, we are rebranding and reimagining how these payments will be made. And we are partnering with Care Solutions in order to help us process and make all these payments. The workforce payments will begin in 2025. And as I mentioned, this is really, this is huge. This is a big departure from the typical work we do in quality rated. And so there's lots for us to learn. There's lots for us to develop. There's lots of policies. And there's lots of things to consider in how we can make this happen seamlessly and easily for the entire workforce. Making tens of thousands of payments to individuals annually is no easy task, and it does take time. And one of the things that we do know is that the payments will need to be distributed across the entire year. So we're looking at ways that we can distribute fairly and equitably. We need to do this annually across the entire year to be able to keep our administrative costs down, to keep the overhead as low as possible, because the less our administrative costs are, then the more folks we're able to actually offer these bonuses to. So currently we've been thinking about whether it makes more sense to make these payments on a regional basis, maybe looking at the rating anniversary dates of the providers to be able to tie that into when these bonuses are paid, maybe having them paid quarterly along with the commitment to quality payments. So this is an opportunity on those QR codes for us to also hear from you, and what would you like to see, and what would you think would make the most sense. So we haven't settled on the approach yet. We will be meeting with Care Solutions and with DECAL leadership over the coming several weeks and months to make final determinations on what that will look like. And as we make those determinations and we have the policies and we have the plans, then we would definitely be transparent and sharing all of that information, whether we'll be able to get back out in front of an audience again, whether it will be some live webinars, written communication, but you'll have multiple opportunities to communicate with us as you learn how these new pieces are going to come into effect. So I'm going to hand this over back to Woody again now, who's going to be able to share some of those scenarios of what this potentially will look like as we think about moving from here and into the arena of the commitment to quality payments and those higher CAPS rates.
Thanks so much, Denise. All right, it's great to be back with everybody. And so what I'm going to do is just quickly take everyone through some scenarios just to give kind of a general idea of the changes taking place, and like the general idea of like what the payment structure will look like moving forward. And then give you some key takeaways about the overall thinking that went into everything. So, what we're doing here is kind of giving you an overview of what things looked like in 2019 into 2024. So, You may be asking, well, why 2019? Why 2024? Why not everything in between? Um, this is the only real way we can kind of give an a basic apples to apples comparison to the way things were prior to the pandemic and then the way we're moving now that we kind of transitioned away from all that stimulus funding. In the interim, there were policies that allowed for billing to be different. There were additional funding sources. There were one-time increases, and so as we've already talked about, a lot of that funding is expiring, and it just felt unfair to compare back to those to what's happened in between because it wasn't necessarily standardized in any way to any one provider or to multiple providers. Is really dependent on a lot of other factors. So the best apples to apples comparison of just normal policy is really this view from pre-pandemic and post-pandemic. And that normal policy is standardized rates along with some type of enhancement for a quality rating. Um, but as we already talked about, there was some priorities that had to go into where we set our rates. We have to be at the 50th percentile at a minimum. There was a legislative mandate and additional funding to go above the 50th percentile, so we went to the 60th percentile. We wanted to, at the same time, preserve the priority that should be there for quality rated and having a higher quality rating in the QRS. In addition to that, we also wanted to implement our new structure for the workforce. And so with limited funding, there was a decision to go to a 2 and 3-star bonus structure or payment structure for on the quality side, but then higher rates across the board for all providers, essentially resetting that floor with that 60th percentile starting place. And as Denise mentioned, that new starting place or that new floor for provider quality within the CAPS program is that 1-star level, not just licensing the 1-star level. So when we look at these scenarios, that we want to ask you to keep that in mind. And so the scenarios have several scenarios here for childcare centers and then a couple for family childcare learning homes. And these are just intended to show just the average provider. So the average childcare center that participates in CAPS has on average 32 children in CAPS that are getting paid for. And so and they typically are about 60% on full-time scholarships and 40% on like a before and after school or a variable scholarship. And so that's the scenario we're looking at here. And we're looking at payments over the course of a quarter. So we want to give you like a 3-month view so that we can include the old and the new in terms of the quality payment. So what we see here is in the scenario 1, we have a 1-star provider in zone 3. And in 2019, you see the blue represents their CAPS payment rates and then the tier bonus that was included. And as we mentioned, for 1-star programs now going to just get the base payment. But as you can see, the new base payment exceeds the where we were in 2019, even with the tier bonus. In our next scenario, we see something similar, but then we have a 2-star provider in zone 2, same number of children. So once again, just an average child care center kind of perspective. And once again, total payments are higher in 2024 than in 2019, but we see more of that total payment total is from base payments, and then there's a smaller portion that is coming from the quality perspective, but that still exists there since they're a 2-star program. And then our last child care center example, once again, is a very similar, the average provider or average child care center provider. ACAPS, but this time a 3-star provider in zone 1. And once again, total payments are increased over 2019, the last time we had kind of a standard structure. And once again, CAPS payments have increased and exceed the old total, but then you add on a smaller bonus relative to the old bonus, but still total out to be higher than 2019. And then now we'll move into a couple of scenarios for family childcare learning homes. So the average CAPS family childcare learning home has 4 CAPS children in care. Typically, that is 3 children in full-time care and 1 after school. And we see very similar outcomes as the prior scenarios, meaning like a 1-star program in zone 3 is going to have higher total payments. But once again, there's no tier bonus anymore, but the CAPS payments now exceed the combination of both of those items in the past. And then finally, we have a 3-star family childcare learning home, once again with 4 children. In zone 1, we see a smaller total bonus, but a larger total payment amount from the last time we had standard payment policies. So some of the key takeaways to keep in mind here, once again, we are increasing caps rates and quality commitment to quality payments, and that the vast majority of providers will see an overall increase from pre-pandemic policies and practices. One-star providers will not receive quality payments bonuses. However, they once again they are the starting point for caps, so they will see higher caps rates, and the vast majority will see a total increase in their caps payments from pre-pandemic levels. Quality rated will offer additional supports to one-star caps providers to help them work towards earning 2 and 3-star ratings in 2025. I'm sorry, they will help one-star providers getting towards that 2 and 3-star rating as we move into 2025 with additional supports that are not necessarily the same as like those bonuses, but other structural supports and technical assistance to help them achieve a higher rating as they move forward. And then overall, this change represents a $98 million of new investment in caps and the commitment to quality rated payments. And it really does represent the largest single and sustained funding increase that we've been able to put into caps in CAPS history since it's been with DeCal. And with that, I will now shift over and turn us over to Anne with CAPS.
Thank you, Woody. My name is Ann Panzica, and I am the Education Outreach Manager for Provider Relations. So we're going to be talking about some key points, just to kind of reiterate some of what my colleagues were just discussing. So basically, what the takeaways are that CAPS will pay either the provider's published rate or the CAPS rate, whichever is less. So with Access, CAPS is able to pay the full published rate for the provider, which is part of the reason why, well, it was the reason why providers were not able to update their rates in the system. Now we're going to be comparing your rate to the CAPS rate and paying the lesser of the two. The CAPS rate is updated based on federal regulations and funding availability. And the families are responsible for paying the assessed family fee, which is what they're currently doing. Not every family has a family fee because it's based on an income to family size ratio. So if a family does have a family fee, that's not going to change until they go for their annual redetermination. They may have a fee assessed at that time, but the family fee is not changing. However, families are now also going to be responsible for paying the differential, if applicable. So if there's a difference between the provider's published rate and what we're able to reimburse, then the families will be responsible for paying that. So to be able to see those state maximum reimbursement rates, you can go to our webpage, which is caps.decal.ga.gov, and you'll go to the top where it says Provider Relations, and that is where you're going to find the state maximum reimbursement rates. It's called the Proposed State Maximum Reimbursement Rate. You can see right here, here's an example of Zone 1. There has been an increase where it says center, that's the center rate for those different categories of children. And the family informal is referring to family child care providers and informal providers. Here's an example of Zone 2, the CAPS rates for Zone 2. Again, with the center and the family informal. There has been an increase. And here's an example of Zone 3. So some other important information about changing rates in Georgia CAPS. Providers are now able to update your rates in the Georgia CAPS system. Many of you have done that. Thank you. If you have not done that, you can go ahead and submit your rates now. I can't guarantee that they would be effective on Monday, the 30th, but you can go ahead and have it effective any Monday. And there is no limit to how many times you change your rates in the system. So the rates, though, that will be applied for the week of the 30th, you need to make sure that the effective date is after the September 30th. If the rates that you submit contain a mistake, you will not be able to make corrections until after a CAPS consultant reviews them. So what we've been doing is looking at the rates in the system, our consultants, and then also comparing those to the rates that are submitted on your rate sheet, just to make sure that they're accurate and to make sure that there have not been any mistakes made. But you want to make sure that you're reviewing those before you hit submit, because you will not be able to make any corrections after the fact until they're returned to you. You can also find all of the rate change instructions on our webpage. We have both the written instructions and we also have a training video as well, if you'd prefer just to watch a video. So again, this is where you're going to find those instructions on changing your rates in the system. Everything that has to do with access ending is now currently housed under important updates in the system. And I definitely recommend that you visit our webpage. We have a lot of information there. There is the training videos can be found here on the webpage under training and news videos. And then, of course, the instructions, the written instructions can be found under informative resources, written instructions. So if you have already submitted your rates and you want to see what the status is, whether or not they've been approved or if they've been returned for revision, you're going to go to the Georgia CAPS portal and then select Request Change and go to Submitted Requests. And there you'll see the request number. If you select the request number, then you'll be able to see the actual rates that were submitted in the system. But if you just look under the submitted requests, you can see whether or not those rates have been approved. And that is, if you select that hyperlinked number for the request, then you can actually see your submitted rates in the system. So if you'd like to know how much the family is going to owe, if your rates are greater than the state maximum reimbursement rate, you can determine the differential by going to the SMRR, or the state maximum reimbursement rate, and view your zone and the type of care that you're delivering. And you can actually see what CAPS is able to reimburse, and you can determine the differential that way. The scholarships will be updated very soon, and you'll be able to view the scholarship. But for now, if you'd like to know what the differential will be, you can look at that state maximum reimbursement rate and compare your rate to that rate. So if you're looking at the scholarship and it's Monday the 30th, you can take a look at the scholarship and then select the name of the child that you'd like to view the details for, to view the differential. And here's an example of a scholarship view in Georgia CAPS. So you can see the amount that the provider charges. It'll be updated if there was a rate change request submitted. So if you've submitted your rate change request before the 2nd of September, you can see your rate there. Otherwise, you'll have to wait until the next week if you submitted it later. And then you can see the state maximum reimbursement rate that will be updated as well. And then you can also see the family's fee. So the family fee you do need to charge. That's actually a federal regulation. You need to be charging the family fee. However, the differential is optional. That's up to you and your business practice as to whether or not you're collecting the differential. And you can see the weekly responsibility, which will be both the family fee and the differential combined for the parent weekly responsibility. That will also be on the scholarship. And if you still need help or if you have any questions, we have technical assistance sessions once a week, and we call those Georgia CAPS 101. We are now focusing on the rate changes and all of these policy changes, but we're also providing technical assistance. So if you'd like to register for the Georgia CAPS 101 session, you can go to our webpage and you can just click on the link to register for the session. You also can call CAPS provider support at the number there, and also the email is showing there as well. So you're welcome to contact us that way. We also have started our live technical assistance series. So we're going to be having once a month sessions. Our next one is at Catoosa County Library in Ringgold, Georgia. It'll be October 10th from 10 a.m. to 2 p.m. And you are welcome to just show up, or you can register for that session. So we also have been sending out a lot of different communications through informational resources as well. We have these available on our webpage. We have FAQs if you'd like to review those. We have webinars on our webpage, recordings of webinars. We have our newsletters that we send providers on a quarterly basis. All of those are housed on our webpage as well. We also have links to the Thriving Business Academy. We have our provider handbook, we have user guides, and a lot of information is there on our webpage. We also have training videos on our webpage, and every workshop that we've delivered to providers, we record and we keep there. So if you'd like to review any of those, you're welcome to go there and review those. And again, everything that has to do with these changes are now housed on our webpage under important updates. So I definitely encourage you to go there and just review the information. We have flyers that are really easy to read and understand that just kind of highlight the key points that we've been going over today. And to stay informed, we have our webpage, of course, that I've been discussing. There's also information there about how to contact quality rated support. We also have been sending portal messages. So when you go into your dashboard for Georgia Caps, there'll be sometimes we'll send bell notifications, or there will be a message on the banner. That also is something that we use to be able to communicate with childcare providers. We also have our newsletters that we send out. And then, of course, you can always reach out to us through our CAPS provider support number and also the email. So I'm going to go ahead and turn it over now to Bentley Ponder, who's going to be discussing the Thriving Childcare Business Academy.
Thank you, Anne. Good to be back with everybody. I'm going to talk about our Thriving Business Academy real quick and then close this out. So last year we were able to launch DECAL's Thriving Childcare Business Academy. We've seen great success with this. This was one of our projects with pandemic relief funding provided us the start, and then we've been able to continue it for at least the next year. You can see here the different options with Thrive. You can find the link to Thrive on our website. And I just want to say I hope that everybody is able to take advantage of these. And I would point out the small study groups have been quite successful and a lot of satisfaction there. And then there's a lot of resources in the self-study guide library. I think there's over 60 as of now. We do plan on adding new resources soon, so we will have a payment estimator tool that we are developing with one of our partners in Thrive, Civitas Strategies. And through that, you'll be able to estimate what your quarterly bonus pay, what your commitment to quality payments will be, along with what your weekly payments you should be receiving based on your children that you're serving and their ages and all the other elements that go into that. We will also be launching a new CAP small study group, and then there'll also be additional one-on-one coaching. And again, you can find more resources at our website and more information to come. So that is the end of our presentation. I can honestly say this was more difficult to do like this than it is in front of a of a meeting. I anyway, but we are glad to do that, and it's been a really great being able to be out and see everyone. And my commitment is that we will continue to do more of these, and as we learn more, we will be out sharing those. You'll see the QR code on the screen, so please submit questions. When we post the webinar, we will post how long this QR code will be live. Thank you for listening to everything. Thank you to everybody who came out to see us. We are so sorry that we are not going to be able to hold Friday's session, but I think everybody is aware of the weather forecast and why we are unable to do so. You can also email us directly. And again, thanks so much, and we hope to see you soon.